Most people think they would know if they had diabetes. They imagine they would feel it clearly: intense thirst, constant fatigue, dramatic weight loss. But the reality is very different. Diabetes is one of the most underdiagnosed chronic conditions in the world precisely because it hides. It sends signals that look like something else entirely: a skin problem, a vision issue, a slow healing cut. And because no one explains these signals, millions of people miss them for years. In this video, we are going to change that. My name is Leah, and this channel is dedicated to giving you clear, evidence-based information about diabetes and blood sugar management. In today's video, we are going through 5 hidden signs of diabetes that almost nobody talks about, explaining exactly what causes each one, why it is so often missed, and what you should do if you recognize any of them in yourself or someone around you. Before we begin, if this kind of content is useful to you, subscribe to this channel and turn on notifications so you never miss a video. Let us start with the first hidden sign, and it is one that appears directly on the surface of the skin. It is called acanthosis nigricans. This is a condition characterized by dark, velvety patches of skin that develop in specific areas of the body, most commonly on the back of the neck, inside the armpits, around the groin, and sometimes on the knuckles. These patches do not wash off. They do not respond to cream or exfoliation. Many people assume it is a hygiene issue or residual tanning, and they live with it for years without ever connecting it to their blood sugar. Here is what is actually happening. When blood sugar remains elevated for extended periods, the body produces excessive amounts of insulin in an attempt to compensate. That excess insulin circulating in the bloodstream stimulates the skin cells in those warm, folded areas to multiply faster than normal. The result is thickened, darkened skin tissue, a visible external sign that the body's glucose regulation is under strain. These patches are not painful and are not dangerous on their own, but they are one of the most consistent early indicators that insulin levels and blood sugar may be significantly out of balance. If you have noticed this kind of darkening on your skin and have not yet had your blood sugar tested, that conversation with your doctor needs to happen. The second hidden sign involves the immune system, and it is one that most people never connect to diabetes. We are talking about recurring infections. Infections that keep coming back despite treatment. This includes yeast infections, urinary tract infections, skin infections, and persistent gum disease. The connection to blood sugar is direct and well established. When glucose levels are chronically elevated, the environment inside the body becomes highly favorable for bacteria and fungi to grow. Sugar, in simple terms, feeds them. At the same time, high blood sugar impairs the function of white blood cells, the immune cells responsible for detecting and destroying harmful microorganisms. The result is a body that has more pathogens than usual and a weaker capacity to fight them. Infections become more frequent, take longer to clear, and return after treatment. For women in particular, recurring vaginal yeast infections are often one of the earliest signs of undiagnosed diabetes or prediabetes, appearing sometimes years before any other symptom. Men experience this differently, through persistent skin infections, recurring athlete's foot, or chronic gum inflammation. If you are dealing with infections that keep coming back without a clear cause, this pattern deserves medical investigation. It is not bad luck. It is your immune system communicating that something deeper needs attention. The third hidden sign is one that people frequently dismiss as tiredness, poor circulation, or simply sitting in one position too long. It is a persistent tingling, numbness, or burning sensation in the hands and feet, and it has a name: peripheral neuropathy. This refers to damage to the nerves that are furthest from the center of the body. When blood sugar remains high over time, it gradually damages the small blood vessels that supply oxygen and nutrients to these peripheral nerves. Without that steady supply, the nerves begin to malfunction, sending irregular and faulty signals to the brain. People describe it in different ways: a permanent pins and needles sensation, a foot that feels perpetually asleep, an invisible pressure around the hands as though wearing thick gloves. The hands and feet are affected first because they are the most distant from the heart, and therefore the most vulnerable to any reduction in blood supply. What makes this sign particularly serious is that as neuropathy progresses, the sensation does not just change, it disappears. And when feeling is lost in the feet, injuries go unnoticed. Cuts, blisters, and sores are not felt, not treated, and not healed. If you experience regular tingling, numbness, or burning in your extremities, do not attribute it to something minor. This is a neurological signal that requires proper medical evaluation. The fourth hidden sign is closely related to what we just discussed, but it manifests differently and is more immediately visible. It is the pattern of wounds that heal unusually slowly, particularly on the lower legs and feet. In a healthy body, a small cut or blister will typically close within a few days. The immune system responds rapidly, blood carries repair cells to the site, and tissue regenerates efficiently. When blood sugar is chronically elevated, this process breaks down at multiple levels simultaneously. First, high glucose causes the blood vessels to become progressively stiffer and narrower, reducing blood flow to the extremities. Second, the white blood cells that would normally protect a wound from bacterial infection are impaired, leaving the injury exposed for longer. Third, the tissue repair process itself is slowed because the biological environment needed for regeneration is disrupted by excess sugar. The practical result is a wound that stays open, becomes infected more easily, worsens despite proper care, and in severe cases, requires specialized medical intervention. Diabetic wound care is a recognized subspecialty in medicine, precisely because the consequences of unmanaged wounds in people with elevated blood sugar can be severe. If you have a cut, blister, or sore that is not healing the way it should, or if it keeps reopening, this requires medical attention. The fifth and final hidden sign is perhaps the most surprising because most people never associate it with blood sugar. It is blurry or fluctuating vision. Episodes where your eyesight suddenly becomes unclear or unfocused, even if your vision has been normal your entire life. The mechanism behind this is specific. When blood sugar levels rise or fall rapidly, the body experiences fluid shifts throughout its tissues. These fluid shifts affect the lens of the eye, causing it to swell slightly or change shape. The lens is responsible for focusing light precisely onto the retina at the back of the eye. When its shape is altered by fluid changes, it can no longer focus accurately, and vision becomes distorted or blurred. What makes this sign particularly confusing is its inconsistency. The blurriness comes and goes depending on what has been eaten, how long ago the last meal was, and how blood sugar is moving throughout the day. One morning vision is sharp, the next it is foggy. People blame screens, aging, or fatigue, and the actual cause is never identified. Over time, if blood sugar remains high and unmanaged, the damage moves beyond the lens to the blood vessels inside the retina itself. This condition, known as diabetic retinopathy, is one of the leading causes of preventable blindness in adults worldwide. The progression from occasional blurry vision to serious retinal damage is silent and gradual. Any unexplained or fluctuating change in vision, particularly alongside other signs discussed in this video, requires prompt medical evaluation. Now let us bring these 5 signs together clearly. The first is dark, velvety skin patches in areas like the neck and armpits, a visible indicator of elevated insulin and blood sugar. The second is recurring infections that keep returning despite treatment, a consequence of high glucose feeding pathogens while weakening immune response. The third is persistent tingling, numbness, or burning in the hands and feet, caused by nerve damage from prolonged blood sugar elevation. The fourth is wounds that heal abnormally slowly, particularly on the lower legs and feet, the result of impaired circulation and weakened immune function. The fifth is blurry or fluctuating vision, caused by fluid shifts in the lens of the eye in response to changing blood sugar levels. If you have recognized one or more of these signs, the first and most important step is not to panic. It is to act. Book an appointment with your doctor and describe specifically what you have observed. A blood test measuring your average sugar levels over the past 2 to 3 months will give a clear and objective picture of where your blood sugar has been. If the results show elevated levels, your doctor will guide you through the appropriate next steps, which may include dietary changes, physical activity recommendations, medication, or a combination of these. The critical point is this: when blood sugar problems are identified early, they are significantly more manageable. In cases of prediabetes, the condition can in many instances be reversed entirely with structured lifestyle intervention. In the meantime, there are evidence-based habits that support healthier blood sugar levels regardless of where you currently stand. Reducing rapidly absorbed carbohydrates, processed foods, sugary drinks, white bread, white rice, and replacing them with fiber-rich vegetables, legumes, and lean proteins will reduce post-meal glucose spikes. Regular physical activity, even a 20-minute walk after meals, causes muscles to draw glucose from the bloodstream directly, producing a measurable reduction in blood sugar without medication. Adequate hydration supports kidney function and the natural elimination of excess glucose. Consistent quality sleep is non-negotiable. Poor sleep measurably reduces insulin sensitivity and raises fasting blood sugar the following morning. And chronic stress management is equally important, as cortisol and adrenaline released during stress instruct the liver to release stored glucose, raising blood sugar independently of food intake. These are not optional lifestyle preferences. For someone managing or at risk of this condition, they are clinical tools. Thank you for watching this video. If it has been useful, share it with someone who needs this information. Take care of your health, and we will see you in the next video.